From our 22 News Broadcast Center, this is 22 News in Focus.
Good Sunday afternoon. Welcome to 22 News in Focus. I'm Kate Walsh. It's considered an epidemic across the Commonwealth. Opioid addiction and overdose, whether in the form of heroin or prescription pills, these opioids are taking too many lives. So today we'll talk about this increasing problem, treatment and punishment for addicts, and the impact it's all having on communities across Western Massachusetts. Today we have a panel of guests joining me all at once, a different way of doing it today. They're all going to share their expertise on a variety of topics related to this epidemic. So we'll go down the line here. Sergeant John Delaney, the aide to the Commissioner of the Springfield Police Department, Officer Mike Wilk of the Chicopee Police Department, and also the Public Information Officer. And we have Patrick Leonardo, Operations Manager of the Ambulance Service American Medical Response, better known as AMR. We have Liz Wynot, Program Director of Tapestry Health's Needle Exchange Program. And we have Dr. Thomas Higgins, President of Bay State Franklin Medical Center and a member of the Franklin Opiate Task Force. So thank you all for being here today to share your expertise with us.
Thanks for having us.
We appreciate it. So first, Governor Deval Patrick declared a public health emergency in regard to the growing abuse of opiates back in March of 2014. And since then, Massachusetts and other states around the country have been working with the federal government to find ways to prevent people from becoming addicted, as well as finding treatment for those seeking help. But before we get into the specifics of all of that, let's first get to the basics. What is an opioid? We always say that word opioid, but Doctor, what is it?
So an opioid is a drug that acts at a specific receptor in the brain. It's derived from the term opium, which is made from poppies. And you might wonder, why do we have receptors for poppies in our brains? Well, it also has a lot to do with the pleasure mechanisms. And an opioid is any drug that occupies that receptor. So it could be heroin, it could be OxyContin, it could be morphine, it could be any variety of drugs. And they're all classed together as the term opioids.
So we also say opiate. What's the difference there? Opioid, opiate?
The same.
Okay.
Yeah.
It seems like they're very addictive, these pills, the heroin. Why is that? It seems like one person, they'll have it once and then become addicted.
Well, it's an interesting question. It has a lot to do with the stress response system, and some people's brains are wired differently than others. So if you take anyone in the population and give them a certain chemical, about a quarter of the population won't taste it as bitter, a quarter of the population will taste it as extremely bitter, and the rest of the people say it's just sort of ordinary. We're the same way with receptors in our brains. Everyone's a little bit different, and some people have a predisposition to respond to opiates in a way that others do not. There's other things that enter into that as well. If you've been stressed earlier in life, that seems to increase your predisposition to it. If you've had previous problems with addiction with other substances, that seems to predispose you as well. The problem is, for doctors prescribing medicines for pain, you don't necessarily know if a patient has those risk factors, and thus a certain piece of the population, and the estimates are anywhere 10 to 20%, are very susceptible to addiction.
Okay, so what does it do to the body when you take an opioid?
Well, as soon as an opioid acts at that receptor, it has a very calming effect, and in some people can also produce a euphoric effect. And we actually have natural endorphins, or endogenous opiates, within our system, and they're there naturally. So it's thought that some of this was basically in the days before there were medicine. If you were in a lot of pain, your body would release natural painkillers to help blunt that sort of pain. Of course, nowadays we have more modern, more powerful medicines that can do that for us, but the system is there. When you take an opiate, whether it's heroin or a prescribed opioid type drug, it acts at the same receptors, produces that calming effect, relieves some of the pain you're having. So it's all the natural response, just amplified by large doses of an external drug.
And that's the same effect for heroin as it would be for prescription pills?
Yes.
With opioid? Okay. So on the outside, that's how you feel on the inside. On the outside, how does a person seem? Can you guys tell if someone is high on opioids? Maybe they've taken heroin? Is it very obvious?
In some investigations, when we're doing drug investigations, it's very clear to the trained police officer, especially the people that are working in narcotics. They can tell whether somebody's addicted to the heroin by the size of their pupils, other mannerisms, so they speak. And if they're addicted for long periods of time, they tend to pick at their skin. They have pock marks on their face, the way they look. Like the doctor was saying, when you take an opioid, it's more or less a downing effect, and they nod off. And you can tell by the way the people are interacting when you ask them the questions whether or not they're high on heroin or if they had just injected it or not.
How about when there's an overdose? Can you tell if you get a call for someone who maybe passed out and they OD'd on something? Can you tell that it's heroin related or prescription pill related opioids?
Well, we may tell that it's an opiate overdose, such as the sergeant had said that there's telltale signs of it. One of them is when you overdose significantly, your respiratory drive decreases, your pupils will be constricted. The paramedics and EMTs are trained to pick up on that, and depending on your vital signs, your blood pressure, your pulse rate, we have the Narcan and the ambulance, which we can administer in several different ways. And we start at small dosages to see whether or not that is actually what is going on first, and we have a positive reaction and a good outcome to it, we can actually increase that to the point of waking the patient up to bring them out of their overdose.
Okay, interesting. So there's the debate, and we'll get into this later as well, but there's the debate right now, should these people who have addictions to opioids be put in jail or should they go into a treatment program? And we'd like to hear all of your aspects on that. So would you guys want to start with that?
Well, when a person who is addicted, our belief is that if that person needs help, seeks help before committing a criminal act, there should be some type of a program that they can get into for help. If they do break the law, such as an armed robbery, something like that, there are criminal consequences to those actions. So that's how we look at it in our department.
And how about you guys?
So, I mean, we see it does not discriminate across socioeconomic boundaries, so anybody can be affected, whether it be an addiction or a disease process that has taken place. So to us, it's more education and prevention. For us, it's the emergency aspect of saving somebody's life from going into full respiratory arrest at that point. We're not there to judge anybody. These people are loved ones. They can be your brothers, sisters, aunts, father, mother. So we treat them at the time to the best of our ability and bring them down to the hospital. And at the hospital, the decisions get made as to the kind of help and treatment that they can receive to further become better citizens and become productive in society.
Liz, would you want to add?
Yeah, also at Tapestry Health, we oversee a pilot program, and we're located in all 4 counties of Massachusetts. And we can train anybody that's at high risk for witnessing an overdose, and we go through a short training of how to recognize an overdose, how to respond to one, including the importance of calling 911, how to do rescue breathing, and how to give Narcan. And we actually can give the kit to people to take home with them in case they witness an overdose. And as I think Narcan, it's really there to allow the person to live another day. Some people won't be ready to seek treatment at that time. A lot of people will. But there's a lot of people that, even if they're not ready at that time, the Narcan allows them to live another day and seek it when they're ready.
So the importance, it seems, is saving a life, most important, and then going into if there's criminal charges later on. Would you want to add your perspective on that as well?
Well, addiction's a brain disease, and it's really not a whole lot different than if you have diabetes. You need something that the normal person doesn't need if you have diabetes to control your blood sugar. With addiction, you need to avoid something that other people can probably tolerate just fine. And it's a very complex and multidimensional problem. There's the immediate life-saving aspect of giving a drug like naloxone or Narcan to resuscitate the person, and then whatever other medical help they need at that point. Then there's referral for treatment, and people have to be ready to recover before they're going to accept that treatment. The recidivism rate is very high, and one of the things that we're sadly seeing now is people are getting into treatment. They come out of treatment. Their need for heroin is so strong that they'll go out and use, and they'll die with that first dose out of treatment, because now their resistance has gone down. I think another important thing to remember is you develop a tolerance to opioids, and what would normally be a normal dose, say for pain relief, you might need to use 10 times that dose in an addict. And similarly, if you're resuscitating them with naloxone, we're seeing that we need bigger and bigger doses than we ever used to see in the past. Used to be 1 amp of naloxone, 0.4 milligrams was enough to resuscitate most people. Now sometimes it will take 2, 3, 4, 5 doses.
Wow, so it's using up resources as well.
Well, that's true, but I mean, I think more important is the education of first responders and doctors that the game has changed, particularly in the past 2 or 3 years.
All right, and when we come back, we're going to talk about a recent deadly strain of heroin. It killed at least 8 people in the greater Springfield area just about 2 weeks ago. So we'll talk about that specific case as well as many other issues related to the opioid epidemic in Massachusetts. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're talking about the opioid addiction crisis in Massachusetts, and we've been talking about how easy it is for someone to become addicted to opioids. Now we're getting into the specifics. There was a deadly strain of heroin known as Hollywood heroin just about 2 weeks ago that killed at least 8 people in the greater Springfield area. Holyoke, Chicopee, those areas were affected. First, let's talk about the medical aspect of this. What makes a strain of heroin particularly deadly?
Well, it's the potency of the heroin or whatever it is, and we've actually seen instances in the recent past where what was sold as heroin was actually cut with fentanyl, which is another potent opioid. It's about 80 times as potent as morphine. So, but the problem is you don't know if you're getting 5% heroin or 100% heroin on the street. It all depends on what the supply is and what it's being cut with. I've been an ICU doctor for 29 years now, and this used to be a disease that we had pretty much under control. We could resuscitate people because I think what was on the streets 10 years ago was not as potent as what it is now. But for whatever reason, the potency has increased, but it's exceedingly variable, and so someone who's using does not know what they're getting.
And Liz, have you noticed that this affects all different types of people in society? You know, it might have been one time a low-income type drug that people would take cheap, but do you find that it's affecting all types of people now?
Well, I think that the overdose crisis has been around for a lot longer, and I think there's always been waves of being high and low, but I really kind of admire the media attention and the attention of the community that's been happening for the past couple years because so many people are focused on it. I feel like in a way it's becoming more, people are noticing it more and more around them. I have seen an increase, there's definitely been an increase in overdose deaths in the past year. I think it's doubled in the country. And aside from, you know, with the Hollywood batch that's come out that was really too strong, it was pure. So people, again, they don't know when you're taking a certain bag how pure the heroin is or also like what's mixed in with it. But in addition to that, a lot of times when we see overdoses or when people report overdoses, it's because they're getting out of treatment or have gone without an opiate for a while, and then when oftentimes when they start, you don't know what's in the bag, and you don't have a tolerance to it anymore. The other thing is mixing drugs is very dangerous, so especially benzodiazepines is another medication, and when mixed with an opioid, which can be common among some people, that can be very dangerous, in addition to alcohol and cocaine. And the thing that I'm seeing a lot and that trying to bring awareness to with the injection drug users I work with is it's really important not to use alone. A lot of the fatal overdoses that have been happening are with people that are using alone. Most overdoses are witnessed by another person, but most fatal overdoses happen when no one's around.
Okay, so back to this particular strain, this Hollywood heroin as it was called. What goes into an investigation like that? Springfield police were the ones arresting the 4 people involved in dealing this, allegedly. So what goes into an investigation? How do you find out about this strain? How do you trace it back to its origin and who was responsible?
When you're doing an investigation like this, like was just done recently where we took 9,000 of the Hollywood bags off the street, 3 days prior to that, we got the word from Chicopee and other departments that they had overdoses, up to 8 in 3 days, which is a telltale sign to the narcotics investigation that there is a pure batch of heroin out there. It's not hard because right next to the person that's overdosing is the Hollywood bag. So it's very easy to trace what is the reason and the cause for it. Then we did an investigation, and like all our narcotics officers are very good at their job. They traced where the source was coming from on that Saturday after the overdose deaths, and they got a lead, they investigated it, and there was a delivery being made, and they intercepted that, and they found 9,000 bags hidden in the bumper of a car. You really can't measure how many lives were saved because of what they did, because I'm sure the doctor would have saw a lot of more overdoses coming in if they didn't do what they did. It was really tremendous, tremendous work that these guys do. And when you look at, in 2014, our narcotics division took off 15,000 bags of heroin off the street. In 2015, we took 50,000 bags off the street, arresting many, many dealers. We're up to 12,000 bags so far this year. Is it an epidemic? Yes, because of the purity and the cheapness of the bag. When I was first undercover as a police officer many, many years ago, I bought a bag of heroin. It cost me $35 for that bag of heroin. And it was 16% pure, the first bag I ever bought. Now in Springfield and in Chicopee and Holyoke, Western Massachusetts, it's the same amount of heroin, but on the average it's 50 or 60% pure, and it's $5 for a bag on the streets of Springfield. That just tells your average person that there's a glut on the market, and that's why we're having an epidemic right now. There's just so much of it out there.
And maybe you could help with this. Where is this coming from? Is it caught in Massachusetts? Is it something in South America that's made its way up here? How does it, where is it from?
Well, that's the million-dollar question, you know, and that's where our narcotics officers work to try to find the sources of these dealers and where they get it from. And I would just like to touch on as well, when we learned about the Hollywood batch of heroin, we put it to our social media, our Facebook account, to basically warn people. And we did get calls from people, anonymous calls, with tips on dealers' names and phone numbers, which we turned over to our narcotics officers. And much like Springfield, we have officers who also work with a federal task force and a state task force. And all of our departments work together. Our narcotics officers all talk to each other. They all have informants and contacts. And all our departments realize this huge problem, and they're all working together. And to your guys, Springfield did a great job getting this stuff off the street, because as you know, Sergeant Delaney said, there would have been a lot more overdoses. And for our department, at least after this arrest and our notification, we haven't had any overdoses or any incidents with Hollywood heroin since, so that's a good thing.
And what does this do to AMR and other ambulance services when there's this particularly deadly or dangerous strain? It must take up a lot of your resources, right?
Yeah, so we do see a trend, as they mentioned. So when the batches arrive, you'll see a time frame, whether it be 12, 24-hour time frame, or you do have increased calls for patients that are unresponsive, potential overdoses. We see a couple at a time coming in batches, which we usually would not otherwise see. The big difference is the quality of the heroin that's out there. So by the time we get there, where somebody might have been awake before and is manageable without giving them Narcan, they're completely out now and on the verge of respiratory arrest or already in full cardiac arrest. So at that point, to the doctor's point, instead of giving the lower dose of Narcan, we're having to go 3, 4, 5 times the amount to try to get that effect to bring them back.
Is there any way that someone could overdose, so to speak, on Narcan? Is there too much of the reversal of that drug, have you found? No, so you can just keep giving it and see if it will eventually work.
Right. What the problem we're seeing, though, now is that people used to come in with respiratory rates of 4 or 6 per minute, which is enough to sustain them. They may not be awake, they'd be out unconscious, but they're still breathing. But with the higher doses of opiates, the breathing stops completely, and that means no blood is going to the brain, and that results in the death. Again, you know, I've been dealing with this for almost 30 years, and until last year, 2015, I had never seen a patient that was brain dead from heroin overdose, and one weekend I was on at Bay State Medical Center, we had 2 in one evening. I mean, it's just horrible that we never used to see that before, and it's again because of the potency. And I think the potency also has contributed a bit to people using it that otherwise wouldn't have, because needles were a big stopping block for most people. You know, that's a threshold most people will not cross. But if you can snort it, that doesn't seem as scary. And now what we're seeing is overdoses from snorting heroin, and that's something we didn't see 10 or 15 years ago.
So what are the different ways that people can take heroin and other opioids? Is needle, snorting? Can they obviously swallow the pill? Is there any heroin form of swallowing?
Yeah, I'm not sure I want to give directions here, but it's generally taken by snorting or by injection.
Okay.
I mean, there are pills, opiate pills, but they don't give the same quote buzz that that injection or snorting would be. But I do want to bring up a point, which is how we got here and how the numbers have increased. And I agree with Liz that this is not a new problem, but it has been building, and it's been doubling every 5 years or so in terms of the numbers of people that are affected. And I think what happened is that in the 1990s, physicians were cautioned that we weren't treating pain enough. And a lot of studies that were done with cancer patients were used to show that we were under-treating pain, and people, without really a lot of thought, expanded that from cancer patients to all sorts of pain. So prescriptions went up. Last year in Boston, about 4% of the population is prescribed an opiate. Here in Springfield, it's closer to 8%. Up in Franklin County, it's about 7.5%. Those are people who are prescribed opiates. Then the crackdown came down a few years ago on physicians prescribing drugs, and the drugs became unavailable. So the street price of OxyContin and other alternatives shot up through the roof, and the price of heroin dropped. And so all of a sudden, people who were addicted to opiates, and some of them were doing okay. They were functioning, they were holding down jobs, and you wouldn't necessarily know that they were an addict, were cut off from their supply, so they had to turn to what was available.
All right, and we'll talk about how all of these different groups are working together with the federal government and other parts of the state right after the break. You're watching 22 News in Focus. You're watching 22 News in Focus. Today we're talking about the effects of addiction and the increase in opiate use, especially in Western Massachusetts. Our panel of guests today are actively involved in the prevention and treatment of drug use in our communities in many forms. And so we're going to continue talking about this Hollywood heroin batch of heroin that was recently in Western Massachusetts. Sergeant Delaney, you were saying during the break about how it's actually attractive to some people when this comes out.
Yeah, District Attorney Gallooni, Mike from Chicopee, myself, we put it out right away when we found out that there was 8 deaths in Western Massachusetts due to the Hollywood brand of heroin. You would think that when somebody sees that, they'd stay away from that bag. Well, your addict is attracted to that because they know the purity level in that one bag that they buy will be worth 2 or 3 shots to them. So it's more bang for the buck, so to speak. So when we put it out there, it's like an infomercial that every addict in Western Massachusetts is now looking for that Hollywood bag. It's good that they're aware because it's basically caveat emptor, buyer beware. You don't know, like the doctor said, you don't know what you're injecting in your arm. This is not made in the lab. It's done in somebody's back room or kitchen. And they're mixing it up, and if it has to be a potent batch, like 90% or more, I don't care if you inject heroin 20 times a day, it's going to stop your heart. So it's kind of ironic that it has the opposite effect, that it turns out that Hollywood is the most attractive bag out there right now. It's the most sought out bag. Why? Because it's so pure.
But it's still worth putting it out there, saying that it's dangerous.
Absolutely.
It is, absolutely. It is worth putting it out there. And just to speak to Sergeant Delaney, recently our officers had a narcotics arrest, and one of the arrested parties told our narcotics officers that they were looking for heroin, that your, for lack of a better term, your hardcore addicts will look for the more potent brand of heroin. But from our point of view, it's much better to get out there to people and say, hey, look at this, no heroin is good, but this particular batch is linked to this many deaths. So do everything you can to avoid this branded heroin. You know, and we tried to get that out there so that we could let people know.
And Liz, you were saying each addict is different, though, right? They have different preferences, reasons for using.
Yeah, I guess so, but I do agree with what's been said, and I also agree that it's important, I think, to educate people about what is out there. So we became aware of the Hollywood bag about maybe a couple weeks ago, right before it came out, and we like to educate the injection drug users that come into the exchange because, like what was said, they'll know what they're taking, so hopefully they'll take less than what they usually do, which can also prevent an overdose. And I also, though, want to go back to, with the tolerance, a lot of basically what happens is I think that the addiction, it's increased a lot because of the prescription pill epidemic. And what happens when someone gets cut off is a pill on the street. If you have that addiction, a pill on the street can be about like $10 a milligram, so it could be up to 30 to 40. And then heroin is about $5 a bag. And with building a tolerance very quickly, it's kind of unfortunately natural for a lot of people addicted to heroin to go into injection because it's the quickest route in your bloodstream to get you the highest, and because of the tolerance, you need more and more to have the same effect.
I was, I was speaking with an EMT the other day, and he had said something interesting, how Narcan is almost becoming a crutch for some people. They're going out in parties of people, heroin addicts, and someone is almost like the designated driver. They have the Narcan for the night, keeping watch, not doing the heroin, making sure that no one will overdose, and if they do, they'll be there to help them. Do you find that at all? Does anyone find that Narcan is almost becoming something they're relying on so that they don't die, but they'll continue to use?
When you have a family member that's addicted to heroin, you don't sleep at night, especially when people are overdosing and dying because of it. And it's peace of mind that if there's Narcan available and your loved one is ODing and going to die, you have that there ready to make sure that they don't. And like Liz said, you live another day, and then we can get them treatment. It's all about treatment. We're never, ever going to arrest our way out of this problem. Right. It's not going to happen. Right. We need the state to step up. We need more beds for addicts. That's how you're going to cure this problem. There's a crime problem in Western Massachusetts. That's no secret. And a lot of it is because of the heroin addiction. Right. And how do we solve that? We get these people help. We're not going to arrest our way out of this.
I agree.
Also add that the only side effect of Narcan is withdrawal. So like I often say I don't have any opioids in my system, so I could take it and it wouldn't do anything to me. But if I have a dependence on opioids, I'll go into immediate withdrawal, which basically feels like having a bad flu. So that is something that people addicted to heroin don't want to feel. So as far as it being a crutch, that's not true. People don't do it to intentionally overdose, and also I like to think about what's the alternative. If Narcan wasn't there, how many people would be dying? And also with the designated driver, when I think of alcohol or something else, like I see it as a responsible thing. I think it's good for people to have the Narcan on them and to educate those around them and to have it just in case, just like it would be to have a designated driver if you go out at night with your friends.
And for people at home who might not be familiar with Narcan and what it does, would you be able to talk a little bit about that, Patrick? How exactly is Narcan used when you go to a house and you see someone who may be overdosing from heroin? How do you use the Narcan on them?
So there's several methods that we can use. In the past, a lot of it was intravenous, so we would have to start an intravenous line on the patient, and you administer it through the IV. And it takes under 60 seconds, sometimes up to 30 seconds. It's very fast acting. We want to move away from needles, obviously, due to the safety of our caregivers, the paramedics, the EMTs, and patients, because we don't want anybody getting stuck with the needles. So there's other options now where we can actually spray it up into the nose. It takes a little longer, but still the same effect, and it can also do the same reversal effect as the intravenous now.
And all departments are supplied with Narcan, right?
So
no?
Not yet.
No.
Not yet.
Working on it.
We're working on it.
Yeah, we just got a grant up in Franklin County to distribute Narcan. It's a $100,000 HRSA grant to get Narcan out into the hands of first responders in the northern counties. It hasn't completely gotten there yet, but people can even go to CVS now and get Narcan without a prescription. And I think if you have a family member who is using and you're worried about them, it's good to have that on hand. Oh, I want to say one other thing, that Narcan reverses opiates, but it doesn't reverse other drugs that you might have in your system at the same time. And it's becoming increasingly common to see people who not only have opiates in the system, but also benzodiazepines, drugs like Valium or Versed, antipsychotic medications, antidepressant medications, and all of these interact. And a dose of morphine or heroin plus a dose of Valium is more than the combination of the two. They're synergistic. You get a much bigger response when you're taking more than one drug at a time. And that is contributing to the number of deaths that we're seeing again. So Narcan is important. You should have it. It's good against heroin, but it's not a panacea. It doesn't reverse all drugs.
All right, and so when we come back, we'll talk about treatment for people who are addicted to some form of opioids. You're watching 22 News in Focus. Welcome back to 22 News in Focus. Today we're having a very interesting discussion about the issues surrounding the opioid addiction crisis in Massachusetts. Our panel is made up of people who are working to stop these issues through prevention and treatment. So we'll start with you, Dr. Franklin County is soon to get treatment beds, which has been a lot of talk in Western Massachusetts about these treatment beds to get people in long-term and short-term care who are addicted to opioids. So could you give us an update since you are a part of the task force?
So we have treatment beds all over Western Massachusetts. There's just not enough of them.
Right.
Up in Franklin County, the old Lunt Silver Factory is being repurposed as a addiction treatment center with 32 inpatient and 32 transitional beds. There's a lot of ways to treat this. Not everyone needs to be hospitalized, but people do need follow-up, and they need it for a longer term of time. You can't have someone go to treatment for 2 or 3 days. That's not going to do it.
Okay, and what have you found with treatment and prevention? What kind of things are out there right now for people who might need help?
A lot of the detoxes now also offer medication-assisted treatment when you go in, and there are also clinics where you can get that. So with medication-assisted treatment, I mainly mean Suboxone, which is buprenorphine, and methadone, and those are opioid replacement therapies. And what happens is medication-assisted treatment has actually shown to decrease the potential for an overdose, because if taken properly, the person won't get high from it, but it'll replace the cravings, and they won't have to deal with the withdrawal, and it basically makes the person able to just live and just live a better life, I guess. 10 years ago, I didn't really hear of Suboxone that much, and now it seems like it's becoming more and more accepted as another form of treatment.
It seems like people are divided over these needle exchange programs. Some people believe that it's a safe way to get addicts in and, clean needles so that they're not exchanging diseases along with everything else that's going on. But some people think that it's only adding to the addiction because it's a way for people to just easily get needles. So would you be able to weigh in on that, and anyone else?
Yeah, people are going to use, regardless of whether they have clean needles or dirty needles. And if they're using dirty needles, they're at risk for hepatitis C and for HIV infection. And we did a lot of work in the 80s and 90s to reduce the incidence of those things, and we hate to see that coming back up again, but it is coming back up again because of people sharing needles. So we do have needle exchange in Northampton. We don't have it in Franklin or in Hampden County. Oh, except for Holyoke, yep.
At Tapestry Health, right, in
Yep.
Holyoke. And it's right outside, so does that help with people feeling like they can remain anonymous?
Yeah, we're a low threshold program because heroin users are really hard to reach, and actually needle exchanges are extremely effective at reaching people that aren't and have never been engaged in any other services. And needle exchange is one component which has successfully shown to prevent HIV and hepatitis C. But in addition to that, we also provide a lot of counseling and testing around. We do HIV testing, hepatitis C testing. We also do a lot of counseling around substance abuse treatment, and we try to work with the person where they're at. So we don't force treatment on somebody, because unfortunately addiction, I see it as like kind of a cyclical process. When somebody stops using, unfortunately a lot of people will relapse, and it's a process, not so much as a, just something that happens. So we want to be there for when that relapse happens. And hepatitis C has drastically increased over the past 20 years, especially among, I believe, 15 to 24-year-olds. That's the group that it's rising the most. And also in Western Mass, about 30% of positive HIV cases are attributable to injection drug use.
And let's talk about that age group, 15 to 24. That's so young. So, I don't know if schools still do the DARE programs and whatnot, but is there anything that you guys are doing with schools to help prevent that and educate children, basically?
Well, our one of the things we have school resource officers, as Sergeant Delaney's department does, and our school resource officers do speak to the kids. They talk about the dangers of heroin and other drugs. And they develop great relationships with the kids, so the kids know that they're approachable, and they go to our officers with questions, things they see, things they hear, things they might find, and our officers are very open with them and discuss the dangers and everything that can go wrong. So we do have that outreach with the youth in our community in Chicopee.
And quickly, how do you all collaborate on the state level? What kind of resources are there, and do you think that the state is providing enough of our tax money to this crisis? We'll just go quickly down the line.
I think more can be done. Like I said previously, police departments aren't going to be able to solve this on their own. We need everybody that's here to be on the same page, getting people help. People that are addicted to heroin, they don't choose that when they're younger. I'm going to be an addict. Yes, they choose to use their heroin, but they don't want to be addicted to it, and it's very, very hard to get off of it once you're on it. And we need the state to step up. We need people to come forward and assist with this problem. It's not a police department's problem. It's basically the whole state that needs to get the addiction level down, and when that happens, crime's going to go down for sure.
And Patrick, how about resources for you guys? Would you need more Narcan, or do you find that you're lacking in other things that maybe a task force could provide you in the future?
So Narcan in emergency medical services in Western Mass, believe it or not, historically paramedics have carried it for 20 plus years. The change has been outreaching to now the basic EMT ambulances that are in the area that now carry them. So all ambulance services will actually have availability of Narcan, where in the past that was not the case. And now the extension to first responders, police departments, fire departments. So the accessibility of Narcan has definitely increased because of everybody's efforts, which is obviously a positive thing, which will help increase the outcomes of these patients.
And how about from your perspective?
I just think that heroin addiction and the issues that go around it needs to be seen more as a public health issue than a moral issue. I think people need to stop putting their judgments on people when facing addiction, and instead look at the facts of what can decrease addiction itself, can decrease transmittable diseases like HIV and hepatitis C and everything else.
And you're on a task force. What do you find is?
And I think getting around the table, as we've done with the opioid task force, has been very important, because normally the police don't necessarily talk to doctors, don't necessarily talk to EMTs, treatment specialists. Having everyone around the table, including correctional officers, lets everyone see each side of the picture. Kind of like the old story of the blind man and the elephant. You begin to see things a little bit differently when other people are at the table. And I think we're making good progress there. But I have to say that we could use more resources. We need to get Narcan in the hands of everyone. We need more education of people. We need more treatment facilities. And there are some subtle things that you might not even recognize. Somewhere around 7% of the babies being born now are opioid addicted. So instead of staying in the hospital for a day, they're staying for 2 weeks while they're taken off the opiates. And that's expensive. It costs a lot of resources, and it's really driving hospital budgets into the red.
And it's affecting a new generation of people as well.
Yes.
So, all right, well, we will be right back, and we'll continue our discussion around opioid addiction. You're watching 22 News in Focus. You're watching 22 News in Focus. We've been talking about the recent influx of a powerful type of heroin that caused many people to overdose, and we're also talking about opioid addiction in general terms. It seems like it's becoming more talked about nowadays. Do you find that the stigma around drug abuse has changed in recent years with people talking about it more, or is there still kind of a criminal, oh, why are you doing that, don't do that, let's not talk about it aspect of it?
I think we're going away from that right now. It used to be before that an addict would be looked at like this person should be in jail. Police departments across the country don't look at it that way now. We want these people to get help. Why? Because if they're not using, they're now committing crimes to try to support their habit. Like I said, we were talking at the break, me and Mike, nobody wants to be an addict. Right. And these people that are addicts, they use heroin up to 20 times a day. If they don't use it, they're very sick. They go through withdrawals. It's like having the flu times 100. If somebody walked into your house with a cure for the flu, you're going to take it, and that's injecting another bag in your arm. That's why the viciousness of this drug keeps going on and on. We need to get people help, and like I told us before, we're not going to arrest our way out of this. We need the community to come together, all aspects of the community, Bay State Medical Center, other agencies that are equipped to do this to try to solve the problem for us.
And I agree, and this problem is now reaching out everywhere. Age doesn't matter, occupation doesn't matter, career doesn't matter. One of the things we get in the police department that people come up and say, and it's harsh, is people say, well, they made that choice. And it's a fair enough statement. Someone did make the choice to use that heroin. However, they didn't make the choice to become addicted. And now, as we were talking, there's collateral damage from one person being addicted. It doesn't just affect that one person, it now affects the families, and it affects an entire community. Someone's addicted to this drug, they're going to do more crime. There's going to be more breaking and enterings. There's going to be more larcenies, more armed robberies, more shopliftings. So this is not just that person's problem. It's a community problem, and we all need to come together and work together to try to get people help. It'll make for a better community.
You solve the heroin problem, crime will plummet.
Right. Absolutely.
Absolutely.
How often do you find there are calls for overdose emergencies?
So I mean, that's a tough question. Some of the overdoses that are happening are accidental overdoses, for example, in the elderly population who have had traumatic events in their life and they're on fentanyl or morphine patches, and we show up, they don't even realize the fact that they've overdosed from the patch themselves. So when it comes to the use of Narcan, I can tell you in 2014, we used Narcan about 380 times. In 2015, we were up to 490. So there has been a significant increase in the percentage of the Narcan being used. It doesn't necessarily mean there's an increase in population that's receiving the Narcan. Like we said, the doses have doubled or tripled that point. So that's kind of what we see right now that's happening.
And that's in Greater Springfield, Western Mass, or is that everywhere where AMR is across the Commonwealth?
So currently it's across Holyoke, Springfield, and East Palmetto and Hampden, which is the service area for AMR in Western Massachusetts.
Wow. And do you find that on weekends it's worse, or is it just always?
No, it's very sporadic, and again, depending on the batches that happen, it could be a Monday afternoon or it could be a Friday evening.
I also want to say that historically, people have always been afraid of calling 911, and a lot of it is because fear of being arrested and just many other factors. But one thing that happened a few years ago was the Good Samaritan law was updated. So if people witness an overdose, they can call 911 and they won't get arrested for being in the presence of an overdose or for if they find a small amount of drugs or paraphernalia on the scene.
And that will allow more people to come forward.
That has allowed more people to come forward. Yeah, if people don't have to worry about getting arrested, then that has shown to increase the number of people calling 911.
Something someone told me the other day, and maybe you can elaborate on this, is that oftentimes people take Narcan, maybe a friend has it, and they give them the Narcan, excuse me, and they feel like they're getting better, they're coming to, they're breathing. But the person told me that it's very important to still bring them to the hospital.
Absolutely. There's a concept called half-life, which is the amount of time a drug remains in your system. And it's somewhere around 180 minutes, so 3 hours or so for heroin. And it's somewhere around 50 minutes for naloxone. So you can give someone the naloxone and they look good for almost an hour, and then they can go back into respiratory depression again. So it's absolutely essential to realize that the Narcan is a temporary measure, bring that person to the hospital to make sure that the job is completed, and more importantly, that they get hooked up with the resources that they need to get treatment, because treatment is important.
And so when someone's in the hospital, would they be monitored after that? Is that what the hospital aspect of them going there would be? Or
Yes,
would they have more Narcan?
It depends. It depends on how many other medical problems that they might have. We've seen all sorts of things in the hospital. I mean, we have a kit that we go racing out to the parking lot to give nasal naloxone in some cases, because some people are so seriously impaired and not breathing at that point. We'll look at the other medical problems that they have and decide whether or not they will be safe. But generally, there will be a period of observation for several hours at the very least. And then the hope is to get them right into a treatment program while you have that window of opportunity. People understand that this was a life-changing, a life-threatening experience, and that's always a very good motivation to get people into treatment.
Are there struggles with insurance companies when it comes to finding treatment? Do insurance companies still view this as a crime that they've been using heroin, or is it pretty good and they cover most treatment?
No, I don't think the insurance companies view this as a criminal act. I think the problem is that the coverage for various treatments will vary from plan to plan. And if you have a gold-plated plan, yeah, you can probably get into treatment at a very good place in California. But if you're homeless and you have no insurance, it's going to be very difficult to find a place to get you treatment. And we struggle with that all the time. And we have people, case managers in the ED who deal with those issues. Very difficult for a family member to take care of that on their own, so you really do need some professional help, and sometimes into making the phone calls and getting the patient into treatment.
We do multiple referrals to treatment every day, and I want to say maybe about 1 in 10 of those referrals successfully make it into treatment. It's really common, I'm speaking specifically to Western Mass, to have to wait multiple days to get into a detox, and people, it's very normal at the needle exchange. We're open 8 to 4. They'll come in at 8 and they'll be waiting till 4 for that phone call. So they'll deal with the withdrawal, they'll deal with the frustration of not finding a bed, and oftentimes they leave without getting that bed.
So are there any programs in the works that any of you know about that could help that process, help more people get into treatment, maybe without insurance having to approve it?
There needs to be more beds, and it needs to be easier for people to get into treatment. Like everyone said, I don't think that people need to be forced into treatment. I'm not sure that would help solve the problem, but I know if there's more availability of treatment, that would be a big help.
I think it would be very difficult, if not impossible, for a long-term user to go through withdrawal on their own. You need support and help. It's generally done with the aid of medications such as methadone to kind of taper down the doses. It doesn't eliminate the discomfort, but it certainly reduces it and it makes it more tolerable. But it's very difficult to do that as an outpatient.
Yeah, we need more beds, not jail cells. We need beds for treatment. That's the way to go.
I mean, when you look at it, as she's saying, someone comes in at 8 o'clock, they have to wait till 4 o'clock, they still don't have a bed. It's a lot easier for an addict to go buy another bag and get that fixed than it is to wait for help. So I agree, we need more treatment centers, more beds, and we need to cut the red tape to get people help.
Very interesting conversation. Thank you all for being here. We'll be right back with our last word. You're watching 22 News in Focus. You've been watching 22 News in Focus this Sunday. Today we've been discussing the growing opioid epidemic, not only here but across the country. And as these professionals have been saying, the Northeast is actually the worst of the country when it comes to opioid epidemic problems. And that's our program for today. We want to thank all of our guests for joining us. Thanks to you at home for watching. And if you missed any of it, you can watch it in full on our website at wwlp.com anytime. And you can also find resources to help with addiction there as well. Under our community section, click on Working for a Better Tomorrow. From all of us here at 22 News, we wish you a wonderful Sunday.